Why are Medicare and Social Security sacred cows? Why does the public react so negatively to anyone who threatens the system? Here's why. They've been incredibly effective, not only at enhancing and prolonging life, but also in protecting middle-class wealth and making it possible to pass it along to the next generation. First, some thoughts on health and longevity. In the 1930s, the average additional lifespan of a 60-year-old white male was about 15 years, meaning that if you had survived childhood diseases, if you hadn't died in an industrial accident working in a factory or on the farm, and you hadn't been killed in a war, chances were that you would live to see your 75th birthday before the final exit. These statistics, by the way, had remained virtually unchanged since 1850, through the Civil War, the Gilded Age, World War I, the Roaring Twenties, and into the Great Depression. Get to 60, live another 15 years on average. Achieve 70, look forward to another 9. Life may have been nasty and brutish, but it wasn't necessarily short. Then in 1937, Social Security was enacted, and for the first time, seniors had a steady, reliable income, and retirement no longer automatically meant abject poverty, as it had for so many. Simply creating a floor, even at subsistence level, had an immediate impact, and lifespan at 60, which had remained stagnant for almost a century, slowly began to increase. So seniors were living longer, and some were living better. But in 1966, almost 30% of seniors were still living below the poverty line. Healthcare was too expensive for many more, and just over half had hospital insurance, making older people still vulnerable to economic ruin through accident or illness. Then came Medicare, a single-payer government healthcare system for everyone over 65, with 2 immediate results: a steady increase in lifespans after 60 and a steep drop in poverty levels for seniors. By 1970, the number of seniors below the poverty line had dropped to almost 20%. And by 1980, it was down to 15%. By 1990, to 12%, and to under 10% by the turn of the century, where it remains today. These are astonishing numbers. No other group of Americans has seen anything remotely similar. We can also look at this from the perspective of wealth. In 2011, the 60 to 69 age group had the most household wealth. No wonder we see many financial services ads with gray-haired people enjoying life to the fullest. Clearly, a sharply rising stock market has made today's baby boomers much wealthier than earlier generations, but you only have money to invest in the market if you haven't spent it on other things. Our grandparents had to take care of medical needs themselves, buying insurance or paying doctors and hospitals directly. Now the government does much of it for us. Which brings us, finally, to wealth transfer between generations. Medicare, by removing most direct medical costs from the population that has the most expensive needs, has protected household wealth and made it available to be handed down. I doubt most Americans have consciously thought through the connection between Medicare and inheritance, but they understand it intuitively. Medicare provides extensive, often very expensive treatments with very little out-of-pocket cost to patients or their families. Take it away, or reduce it substantially, and middle-class household wealth suffers greatly, and the ability to pass it along is diminished. The New Deal and the Great Society produced 2 signature programs that transformed life for seniors and made us all less afraid of growing old and falling into poverty. Social Security and Medicare are essential to the lives we live today. I doubt very much that anyone will be able to take these programs away, nor should they. This has been a Stream of Conscience commentary. I'm John Hartwell. Thanks for watching.